Welcome to the video. Today, we need to talk about something that everyone else has been talking about, but it's poorly understood and there's a lot of controversy. Let's talk about coronavirus. All right, welcome back. Let's talk about coronavirus. I want to make it simple for you so you can share it with your loved ones, share it with your coworkers, share it with your kids, because this is a very tough discussion. Coronavirus is not new. It's been around quite a while. They found this virus back in 1937, well before many of us were born, and it caused this sort of illness inside the lungs of birds. And back in 1937, there was a lot of livestock, a lot of farms, and guess what? It would wipe out whole populations of poultry stock. Moving along in the 1960s, they found that this same virus was found inside of people. They found that it would cause symptoms similar to what you see with the common cold, and they came up with all sorts of names for it. They called it OC43, HKU1, NL63, 22NE, all these different fancy names for it, but that's neither here or there. The thing to remember is the reason why this thing is called coronavirus is corona stands for crown. It's Latin. And that's because if you look at the virus, especially under a special type of microscope, it has these pointy crown-like projections coming from it. So that's why it's called coronavirus, or short for crown. In humans, coronavirus infections most commonly occur in the winter months. That's why it's associated with these cold symptoms as well as the spring, like the hay fever-like symptoms you have. So now this brings us up to date. So you have the background, but in 2019, the CDC, also known as the Centers for Disease Control and Prevention, started monitoring this outbreak of the virus. It was happening in Wuhan, China, and they named it SARS-CoV-2. And that's the virus that causes coronavirus, and it's also known as COVID-19. And this stands for 2019. Authorities, they first identified this virus in China, and they were looking for different causes of the sort, but now they found it spread all over the world. So now it's called a pandemic because it spread all over the world. Sadly, the coronavirus, we have not been winning the battle against corona. As I said before, it's affected people all over the world, but it's caused people to die. And unfortunately, the United States is the leader in the highest number of deaths from coronavirus. So the first links to this virus, the reason why people started to talk about wet markets and about bats and people selling things is the first people that were affected with the virus worked in different animal and seafood markets. So they thought that, hey, these were the first animals that transmitted the virus to other people. But then they found out that people with no kind of connection to the markets were developing symptoms. And they found that humans can pass the symptoms on to each other. As I said before, most people who get this COVID-19, they'll have a milder form of the disease. However, about 20% of people get really, really sick and they can't breathe at all. But you have some people, the other 80%, they usually recover. They just have milder symptoms, but they never even need to be hospitalized. They can recover at home. In the United States, the mortality rate, that's the rate of death, is around 6%. It varies amongst different countries, though. Just know that children are not at a higher risk for COVID-19 compared to adults. Pregnant women have about the same risk as other adults, so you don't have to worry about the pregnant woman having lower immune function and thusly being further at risk for COVID. However, in pregnancy, women have a higher risk of severe illness from viruses. So if they do get sick, they usually have a more severe form. However, there are some special groups we need to take care of, and I'm going to go over those special groups. If you have people living in nursing homes, loved ones living in nursing homes or care facilities, if you have loved ones or people that you know who are over 65 years old, or if you have people who are immunocompromised, if they're obese, if they have heart conditions, if they have chronic lung conditions, or even diabetes, are at higher risk for serious illnesses and getting really sick from this virus. So those are the groups you need to really take care of here. There are symptoms to it. So let me tell you how you can know if you have this virus. Well, you could have a runny nose, a headache, a cough, a fever, a sore throat, you generally just feel unwell. And that's primarily the symptom complex that people are going to complain of. And there's no cure for this virus. So if you do get it, the treatments include self-care, taking care of yourself at home and isolating, and taking over-the-counter medication. You want to get plenty of rest. You don't want to overexert yourself. You want to drink a lot of water. You want to avoid smoky or places that could irritate your airways. You want to take some acetaminophen, also known as Tylenol, to reduce your pain and fever. And you want to go ahead and invest in a good humidifier to run some cool mist. Now, how is this virus transmitted? That means, how does it pass from person to person? Well, the Centers for Disease Control, they currently are recommending that people wear a mask in any public places, and they maintain a 6-foot or a 2-meter distance from other people. This means that the coronavirus can be spread from person to person. So tell your kids, tell them as they get ready to go back to school, it can be spread by coughing, sneezing without covering the mouth, dispersing the droplets into the air, and that's how other people are able to get this virus. The other way is if someone has a virus and they didn't know, if they were in that 80%, they just got better from a little, what they thought was a little spring cold. If you touch someone who's had this virus, who is ill with this virus and has the infection, that's the way to transmit it. The other way is if you touch someone that actively has a virus, and then you go ahead and rub your eye, if you rub your nose or touch your mouth. Let's talk about pets. So the way that pets can transmit this virus is through the feces. So a lot of times, your pet, they just kind of run wild. So be certain, if you have a pet, to keep it clean. Make sure you try to keep it indoors, and make sure you keep things that could, the waste products contain that could be passed on to babies or the children, and then children touch everything, and then they could transmit it to you. It's thought that most people are going to come in contact with this virus at some point. So we have to be ready when we do. So that means that we want to stay in tip-top physical condition. But if you do, just know how this thing works. This is a virus, so it works by pretty much coming into the body, and it needs a host to reproduce and replicate. That means it's going to come in and pretty much hijack cells within your body. And then it's going to spread to new cells that haven't been affected. It's going to spread to them too, and grow and grow and grow. It mainly affects your respiratory system, your lungs, organs and tissues associated with it that allow your body to breathe. So that's why you get so many problems with breathing and respiratory dysfunction. So some of the first symptoms are going to be coughing and shortness of breath. Those are the first things you're going to deal with. That's how you'll know that you probably come in contact and probably have had an active transmission. And your immune system is going to try so hard to fight off this illness. So you're going to initially see your temperature rise. So tell babies, hey, you may feel a little bit hot. Your temperature may rise. You'll know by taking your little thermometer and checking. If the person has a temperature over 100.4, you'll know that they have a fever. And then you can put the other symptoms together with it and make a determination from there. And the symptoms may not show up straight away. So you have between 2 to 14 days, like 2 days to 2 weeks after an infection, to have these symptoms. Remember, shortness of breath, a cough, flu-like symptoms like muscle pain, a sore throat, a headache, chills, and also something funny, a loss of taste or smell. Remember those. And in worst case scenario, if this goes on and you don't get better, typically what people will die from is a collection of fluid that encapsulates itself and forms a little ball inside of your lungs. This is called a pneumonia. And this means that air can't pass through that spongy type of feeling, which is your lungs. So air and oxygen oxygen and the blood can't mix properly. And this is how most people begin to suffer and develop a pneumonia, and it gets worse and worse from there. From there, the rest of the organs within the body can be affected, meaning your heart, your liver, your kidneys. And from there, it just goes downhill, and you can have multiple organ failure. And this usually results in mortality. And on a most serious note, just know that the cases in the United States are over 2 million now. So as of today, June 13th, 2020, there are 2,038,344 total cases of coronavirus. Of that many people, you've had over 100,000 people die from it. About 114,625 people die of it. And that's as of this month, June 2020. And lastly, we have great respect for everyone on the front lines and everyone out who are dealing with children, who are dealing in the service industry. Just know that amongst healthcare professionals and the ones that are watching this channel right now, there have been 76,395 confirmed cases among us. And as far as deaths, over 407 of us have died. So let's maintain a nice environment where we're taking care of ourselves, where we take this seriously. And please, please use protective equipment at all times if you're in a high-risk area. This is a very serious illness, and I wanted to make sure I changed the tone a bit before we come to our ending. So as always, thank you for spending this time with me. I hope you can take some of this information, simply put, and share it with your children as they go to school. Share it with their teachers and share it with your loved ones who may not really be sure about what this illness is all about. We must take care of ourselves, our family, and take care of each other. Okay, remember to like and subscribe and join this team and allow us to grow with us, and hit the notifications bell. We post at least once or twice each week. We keep the new content coming, all things health and science, medical, workplace, career, and schoolwork. We cover a wide swath of things dealing with people's bumpy roads of life. And life is hard, right? But keep it positive. We'll keep it positive for you. Stay tuned. I have some great content for you. As always, hang in there, guys.